This is Dr. Daniel Paull, orthopedic doc with Easy Orthopedics, and today we're going to talk about sports injuries, when you should play through and when you should stop. If you like this video, we put out new content weekly, so please like and subscribe. So there's no real magic rule here of when you should play through a sports injury and when you should stop. One depends on, what level you're playing sports, how old you are, and what the injury is, right? So if you're a professional athlete and that's your livelihood and you're making money and you're supporting yourself, that's very different than your 40-year-old weekend warrior. The older you are, the less well you heal. That's why you see a lot of professional athletes. They really don't play past their late 30s, sometimes into their 40s if they're really good. But the older you get, like the stiffer you become, the slower you heal. You're not able to play through an injury that somebody in their 20s would be able to play through. And lastly, depends on what the injury is, right? It's probably the most important criteria. So if it's a broken bone, you really can't play through it. If it's a major ligament injury, you really can't play through it. There's some exceptions to that, but that's pretty much the rule of thumb on that. But honestly, from my standpoint, if you do that activity and that body part continues to hurt while you do that activity, then you probably should not play through it. If you can do that activity and it maybe hurts in the beginning and then feels fine for the rest of it, then possibly you could continue doing it. Now, if later on it continues to get worse and worse, then you got to stop. But if you find it continues to get a little bit better over time, then yes, you're probably slowing your healing potential, but it may be possible for you to work through it. It really just depends on what the injury is and what you did and how old you are. So rule of thumb is the older you get, the less, and if it's not your profession, the less it makes sense for you to play through it. Take some time off, heal, then you can get back into it. If you're younger and you feel like it doesn't hurt while you're doing the activity and you are starting to heal while doing the activity, you can probably continue to do it. But if you find that you continue to do it, it continues to get worse, then you got to stop. Obviously, any like bone breaks or major ligament tears or sort of nerve damage, you'll have to take a break for a bit. There's also concussions. If you get a concussion, you really should not play through that. You do not want to get something called second impact syndrome, which is where you can actually get some level of brain damage if you get another concussion after the first concussion. Sometimes people will get stingers where they're kind of injured their brachial plexus. You usually can play through that if that goes away after a few minutes. So I hope I was able to answer your questions about what injuries you should play through and what injuries you probably shouldn't. If you have any questions I didn't answer, feel free to leave them in the comments below and I'll do my best to respond. But I can't give you any specific medical advice over YouTube because this video and all my videos are for educational purposes only. Thanks for watching.